So today we're going to be talking about how thyroid eye disease and myasthenia gravis can occur in the same patient. And you might be thinking that's a violation of Occam's razor, but both of these conditions are autoimmune and they're both antibody mediated. In the case of thyroid eye disease, you have thyroid peroxidase antibodies, thyroid stimulating immunoglobulins, and other antibodies directed against antigens in the thyroid, but also that can cross-react with IGF-1 at the level of the fibroblast and produce the ophthalmologic features of thyroid eye disease. And in myasthenia gravis, that's anti-acetylcholine receptor antibodies, but also striated muscle antibodies and MuSK. So they're both autoimmune diseases, and so they can occur together. And so you should be thinking about thyroid eye disease when you have proptosis or lid retraction plus diplopia. And in patients who have concomitant myasthenia, instead of having lid retraction, they have concomitant ptosis. And so that's sometimes referred to as a plus minus syndrome because you have a concomitant retraction and ptosis. You should also be thinking about myasthenia gravis in any patient who has thyroid eye disease who has variability or fatigue, which are the hallmarks of myasthenia gravis. And if you have exotropia rather than esotropia, because the order of involvement of the muscles in thyroid eye disease is inferior rectus, medial rectus, superior rectus, and lateral rectus last. And because thyroid eye disease is a restrictive strabismus that produces an esotropia, and so the presence of the exotropia also should be making you think about myasthenia gravis. In addition, thyroid eye disease doesn't cause the generalized weakness of myasthenia gravis, speaking and swallowing difficulties. Although if you have an abnormality in your thyroid, obviously you might get difficulty swallowing. Or if you have systemic hyper or hypothyroidism, it could cause generalized weakness. So you should think about both conditions. If you have diplopia, lid retraction and ptosis, variability, fatigue, exotropia rather than esotropia, you should be thinking about both conditions.